Hello, I am Assistant Professor Maria Muriel de Barros from the Department of Psychology of Rosary College of Commerce and Arts. Welcome to this course that is designed for the third year BA Psychology students for semester 5. The course code is PSD 102, course title Health Psychology. Title of the unit Lifestyle to Enhance Health and Prevent Illness. Module name Health Enhancing Behaviours, Maintaining a Healthy Diet and Modifying Diet. Module number 12. Outline of the lecture: Diet as a risk factor for disease, the need for dietary modification, resistance to modifying diet, interventions to modify diet, family and community interventions. Learning outcomes. By the end of this lecture, you will understand the role of diet as a risk factor for disease, comprehend the need for dietary modification, identify the factors causing resistance to modifying diet, and discuss various family and community interventions to modifying diet. We are what we eat. When we have a balanced, healthy diet, we enjoy wellness and good health. Diet is a risk factor for many lifestyle diseases and is the cause of sudden death due to arterial clogging after high-fat meals. Diet has been implicated in several kinds of lifestyle diseases that are prevalent today. Some of the diseases include coronary heart diseases, hypertension, many forms of cancer like stomach cancer, pancreatic cancer, colon cancer, have their causes in diet. Most research on dietary factors focus on total cholesterol, low density lipid proteins, LDL, salt, and sugars. It has been found that poor diet in conjunction with other factors increases our risk of illness. For example, stress. Having a poor diet along with experiencing high levels of stress increases lipid reactivity. Dietary changes are critical for people at risk of or already diagnosed with chronic illnesses. For example, dietary change, like a change in diet to a high-fiber diet, may protect against obesity and cardiovascular diseases. Consuming diets with high amount of fiber reduces the insulin in the body. Similarly, reducing saturated fats can lower the risk of atherosclerosis and death due to heart diseases, as consuming lesser saturated fats reduces our cholesterol intake. Resistance to modifying diet. In spite of people being aware that they have a health condition, including a coronary heart disease, people are still reluctant to change their diets. A desire to improve appearance is a strong motivator to change diet rather than health reasons. People tend to include more fruits, vegetables, and fibers in their diet, more for the purpose of improving their appearance rather than taking care of their health. Certain individual factors have also found to be useful in understanding resistance to modifying diet. For example, having a low self-efficacy, preference for meats, low level of health consciousness, and a low level of awareness of association between eating habits and illness are associated with poor dietary habits. As people do not understand the relationship between the food they consume and its implications on health, people are less likely to change their diets. Dietary changes that are restrictive, monotonous, and expensive are more resistant to change. If people have to make drastic changes in the food that they consume or in the shopping that they undertake for their food, making changes in diet becomes more difficult. Some dietary changes alter mood and personality. For example, consuming low amounts of cholesterol increases depressive symptoms and reduces mood. Since adherence to change is highest only in the beginning, maintaining a dietary change is the biggest challenge for anyone who wants to undertake dietary modification. Also, a strong sense of self management can enhance dietary control. People who feel that they have control over their diet and their choices of food that they want to consume, they are more likely to undertake dietary change. There are several interventions to modify diet. Usually, interventions to modify diet are in response to a specific health condition. For example, a person who is diagnosed with a coronary heart disease or hypertension might reduce their fat and salt intake. A person diagnosed with diabetes might reduce their sugar intake. Efforts to change diet should focus on education, imparting education on the contents of food and how food affects our health. Certain cognitive behavioral interventions like self monitoring, being aware of the kind of food one is consuming, the amount of fat or salt or sugar that one is consuming, is helpful in modifying diet. Stimulus control and relapse prevention in high risk situations are also useful. Interventions to modify diet should also target different levels of change. A person who is at the pre-contemplation stage of change might be required might requ- a person who is at the pre-contemplation level of change might require motivation in order to move to the next stage of preparing to change. Family intervention, such as family counseling, is also a useful intervention when all family members are committed to bringing about a change in their diet. Husband and wives play different roles in dietary change. For example, husbands may be more responsible in purchasing foods and bringing them to the home, whereas wives may be more responsible while cooking the food. Changing cooking techniques from maybe frying to steaming or boiling foods might be a healthy change that could be incorporated. Family interventions might also include working with other families. Through social activities, discussion among family members, sharing recipes, and potluck could be interventions that could help enlighten other families about how diets can be modified. Family interventions could also include using the print media, newsletters, handouts, using consumer shopping guides to healthier foods, and devising new meal planning ideas. Lastly, community interventions targeting specific groups of people who are at risk of disease or illness. It could be people who are exposed to chemicals or exposed to too much of radiation who could be at the risk of illness. So, community interventions could focus on dietary modification that are specific to groups who are at risk. Certain kinds of interventions have been found to be useful in modifying diet in the community. For example, having diet booklets with information about how diet can be modified, providing formal education on nutrition, or behavioral interventions like encouraging discussions in the community could be helpful in modifying diet. Nutritional educational programs in supermarkets have found to decrease purchase of high fat foods and increase the purchase of high fiber foods. Having interactive machines at supermarkets that provide information about the nutritional content of food has been found to alter buying choices of consumers. You can refer to the following books for this topic. Thank you.